right. Hey, Dr. McCann, great to see you. Would you tell the audience a little bit about who you are, where you practice?
Sure. So I'm Dr. McCann Lee. I'm originally from a small town in central Illinois, and I went to school at University of Illinois in Chicago. I moved to Denver, Colorado, right when I graduated in 2010, and I've been working at my office, Aurora Modern Dentistry, ever since.
Tell us what brought you into dentistry. How did you decide to become a dentist?
Yeah, that's a great question. So when I was 14, living in the country, I actually got into a four-wheeling accident where I was on a four-wheeler and I crashed into a telephone pole without a helmet on. I ended up breaking almost every bone in my face, and I lost a bunch of teeth. So it took 4 years and 9 reconstructive surgeries to fix my face, fix my jaw function, which was really important, and also fix my teeth. So it was a long road. And during that entire process, what I learned was that your smile really is everything. And as you're going through high school, especially, and you don't have front teeth and you can't smile, you can't communicate with people, it can really put you in a dark place. So even though I had my facial aesthetics fixed about my sophomore, junior year, I had to wait until I was 18 and stopped growing before I could get my dental implants and fix my smile. And it wasn't until I got my smile back that I returned to being my old self. So I just wanted to enter the career so that I could do that for other people.
So tell us a little bit about your practice philosophy. How do you see dentistry? How do you see best serving patients?
Yeah, so I think that what's really important is that we recognize as practitioners that the mouth is connected to the rest of the body. I know it sounds simple, but a lot of times people don't make that connection. And so the vision of Aurora Modern Dentistry is that we're the premier oral systemic health institute in the state of Colorado. So we really focus on connecting the oral health with the rest of the body. So we don't just treat cavities and do cleanings. We're more focused on trying to get the patient completely healthy, both oral health, systemic health, and function too. So that could be anything from treating periodontal disease, treating systemic inflammation, to treating masticatory functions, to treating sleep even. Sleep's a big part of our everyday health that a lot of us neglect. And we do that by utilizing modern technology to deliver efficient and comfortable care. You know, my story earlier, I mentioned that I had to do 9 reconstructive facial surgeries. And so I learned a lot about efficiency during those times. You know, it's not comfortable for me to be in a dental chair and keep my mouth open for anything more than 30 seconds. So I learned from a young age that it's really important that we as providers can deliver our care efficiently and comfortably. That way our patients will want to get that dentistry done. You know, if someone comes in and we take an hour to do a crown prep, I mean, nobody's going to want to sign up for that. So we partner with amazing technology so that we can make patients more comfortable.
All right. So Dr. McCann, what can a patient expect to experience when they step into your practice? How do you treat them?
Yeah, well, I think a couple things are important when people come to my office. Number one, patients who come to my office should expect to have the whole body experience, right? So I'm not just looking at the teeth when they come in. I'm looking at their inflammatory levels. I'm looking at bacteria levels. I'm looking at their function. I'm looking at their sleep. So if patients come to my practice, they should expect, kind of a whole body workup when they come in. The other thing that they should expect is a tailored treatment approach to their specific conditions. So what I find often where dentists miss the mark is patients will come in, they'll get a treatment plan to fix everything in their mouth. Well, you know what? A lot of times patients might not be concerned about everything that's going on in their mouth. So it's really important for us to interview the patients first to figure out what their main objectives are. So that way we can tailor our treatment plan to exactly what the patient needs. If I have a busy mom that comes in that just wants to get her teeth cleaned and get on to soccer practice or whatever, we're going to tailor it to that. If I have someone who comes in that's sleep deprived, grinding their teeth, breaking teeth, I'm going to go more towards sleep and function. So I think it's just important that we tailor our treatments to what our patients are coming in for.